India has the highest burden of TB globally, but given the limited awareness and stigma around the disease, very often all we hear on this conversation is silence. So today, let's talk TB. Hi, I'm Ashna Ashish. I'm a lawyer, a public health professional, and an MDR TB survivor associated with Survivors Against TB, which is a survivor led community collective that works with TB survivors and experts to advocate for person centered TB care in India. I'm joined here today by the lovely Dr. Prerna Arora, who's a senior research scientist at the PD Hinduja Hospital, Mumbai. And she's here today to give us a primer on TB. It's basically your crash course on tuberculosis. Dr. Prerna, thank you so much for joining us here today.
Thank you, Ashwin.
I want to start with some of the common symptoms of tuberculosis and how people can differentiate this from other respiratory illnesses because very often it tends to get mixed up or missed out. Could you tell us a little bit about that, please?
Yeah, sure. So, tuberculosis, first of all, is an airborne disease, and the most common symptoms include coughing, fever, weight loss, consistent weakness, and if you have blood in your cough, and or having a fever at a particular time point only in the day, say only in the evenings or so. So, any symptoms associated with the lungs, along with the other loss of appetite, can lead to TB or suspicion towards diagnosis for TB.
What are the different kinds of TB? And are
So
there differences
TB,
in symptoms that come in there as well in
right.
terms of what
So
we see?
TB is actually of two kinds. When we talk about the site of infection or where it has affected in the body, it's pulmonary TB or extrapulmonary TB. Pulmonary is when it's affected your lungs, and you'll have excessive sputum production. Your chest X-rays would show the load of bacteria in your lungs, etc. And extrapulmonary is any other site apart from your lungs. It could be affecting your brain, your kidney, your spines, or abdomen, or anywhere else, any other part on your body. So the symptoms of TB are more or less common with the terms of loss of appetite, weight loss, fever. Along with that, other symptoms, say for a glandular TB, you may have lymph nodes on across your lymph areas, or um, constipation or diarrhea on and off towards indicating towards abdominal TB. So symptoms vary according to the site of infection as well.
Thank you. Could you tell us a little bit about where we can get TB? I mean, are there places where we're more likely to get it?
Yeah, so as I said, it's an airborne disease. So any exposure, anywhere, anyone coughing in the room, we can get exposed to the bacilli or the bacteria. The extent of you getting an infection is dependent on whether your immune function is low, your nutritional status is compromised, or having a immunity which is really at a lower level, which may just pull it up to a disease. So when we talk about the exposure to the bug, it is anyone and everyone is exposed to the bug through the air. The TB disease, as such, is of two types. It's a latent TB infection, which is not wherein a participant is having no symptom, no active disease, and it's just the bacteria is there in the body. It's just not active and flared up. The moment the immune function is compromised, the bacteria gets space to grow, to flare up, and it converts to an active TB disease.
So you mentioned this can happen to anyone, but are there particular groups? Because you mentioned some factors there. So I wanted to know, are there particular groups that are more vulnerable or at a higher risk for TB? And could you tell us why?
Yeah. So there are vulnerable groups like children, adolescents, or elderlies. These usually come under the vulnerable groups. There are people who are immune compromised or having a compromised kidney or a liver function, or are having HIV, wherein the immune system or status is already at a lower level. So that's when the patient can really get triggered to get into an active disease. When we talk about children, yeah, we do give BCG vaccines as well to our children. That's at the childhood, but then by the time it's really the child has grown into an adolescence, the effect or the impact of the vaccine has lowered down. So anyone and everyone then does become at a risk on for the infection.
And along with being immunocompromised, you mentioned nutritional status as a factor as well.
Yeah.
Very often we tend to assume and look at TB only clinically. Could you speak a little bit about how people who don't have access to nutrition and how undernutrition might be a risk factor for TB as well, and how those groups are vulnerable and why?
Yeah. So initially, anciently, they used to call TB as a poor man's disease only. But honestly, right now, in the current situations, TB is no longer a poor man's disease. When we talk about nutritional status or having limited access to nutrition, yes, the poor definitely have limited access, which causes malnutrition to them, and lower amount of nutrients in them can definitely cause a trigger for the immune function to really drop down too low, and um, the body's immune function is not active enough to fight the disease. However, when it comes on to the higher socioeconomic class, on still with today's lifestyle, with today's stress ongoing nowadays, we are starving, we are rushing back to back onto meetings, our health is really compromised on when it's you're seeing patients on and off. We are seeing attending meetings. We are rushing on from one place to another. That's when also our immune status or our nutritional status falls down. We are more towards junk food nowadays, which causes a depletion of the natural source of nutrients, which is really less in the body, which then triggers on the immune deficiency. And in a longer run, it's not that TB comes in overnight or the bacteria flares up overnight. It's over the longer run, when your immune system is slowly dropping off, and the day when the bacteria has gotten adequate nutrition to grow, flare up, and just spread in your body. And then that's when the symptoms really come up and start to show up.
I'm glad that you mentioned one of the myths about TB, that the myth is that TB is a poor man's disease, but that's not actually the case. With that, I want to move towards two kinds of myths and misconceptions. One, in terms of the self, the person affected by TB often has misconceptions around TB. For example, that TB is not curable, or there would be no life after TB. Could you clarify? Could you mention some of these myths and clarify them? And the second is the social myths, right? That very often people believe that TB is a result of witchcraft or poor lifestyle choices, or it spreads by touching. So, could you speak to some of the myths for self and society and just clarify those? Thank
Yeah,
you.
so when it comes on to self, TB definitely, when a patient is diagnosed or suspected to be diagnosed with TB, the fear bounds in a patient that I've got TB, it's not curable, I will not, my life is coming to an end, it's not really going to work where I was, I'm not going to remain that healthy ever. But that's not the case, very honestly. TB is curable, it just requires the appropriate diagnosis, appropriate treatment plan regimen, and a daily activity definitely followed on with the regular medication routines to be followed. You are definitely after, say, again, depending on the type of TB, if you're a drug susceptible TB, it's a 6 months course. If it's a drug resistant TB, it's a 2 years course, which now with the recent development and research, we're trying to get them to a shorter regimens as well. So based on the current entire regimen that is prescribed into you with your clinical status, follow thoroughly, you can definitely be cured. There's a perfect good life, healthier life ahead beyond that. Also, one of the things that come up are the side effects of these medications, because when you're taking medications, it's 2, 3, 4 medications that may come along with the type of with their additional side effects. So what is essential is that as a patient, you go and you inform your clinician that I am facing these challenges and difficulties. The treatment will definitely be tweaked according to your clinical condition situation, which will be with the addition of some more vitamin supplements or antacids additional to your TB medications. So it's always a hand in hand, a proper communication between the patient and the clinician, which then helps the patient also get a good treatment with a better treatment outcome, and the clinician to treat the patient as well. So that comes on with the self um, care that can be taken across, instead of avoiding on towards the myths, really. When it comes on to the society, yes, We've heard that I've got TB because of a witchcraft, a tona, or it's hereditary. Because my mom got it, I will get it, or because someone else has really been suffered with TB in my family every time, I will also get it. That's not the case. TB is not genetic. It's an airborne disease. It's based on the exposure and the immune function and nutritional status of that particular individual per se. So it's not a genetic disease at all. It's not spread by any jadoo tona. It cannot be cured by any jadoo tona at all. It just requires a proper diagnosis and a treatment regimen, thorough treatment regimen that needs to be strictly adhered and followed through.
So, in terms of the social myths about TB, there are also things we've heard around how it spreads by touch or through cutlery. Because it's airborne, people often think that even if you're near someone,
Yeah.
you hug them, you would get it. So, could you clarify some of those myths, please, and tell us what actually is the case?
So it's an airborne disease, but it does not spread by touch. A patient who's coughing around or who sneezed or has spit, yes, aerosols through that will definitely, if inhaled, we can get exposed to the drug. But sharing cutlery or sharing the same room with the TB patient, etc., it's not that since I have TB patient with me, I will definitely get TB. I may be an exposed risk to TB. There are some parameters to screen the household contacts or people who stay along with TB patients, whether they are at risk of TB, or we do some screening routine procedures for those patients. But then it's not that it would be contagious to spread via touch.
So, I want to end with a question on what's a message that you want to give to people about TB? What would you like them to know and keep in mind?
So I just want everyone to know that TB is there prevalent in India, yes. We are working hard towards its elimination. We hope to eliminate soon, but TB is definitely curable. There is a healthier life ahead beyond TB as well. So if you are suspected or diagnosed with TB, just follow your regular routine medications, prescriptions that have been given in the fear of having the disease, not getting a proper diagnosis or a delayed diagnosis can trouble you more rather than help you more. So the best thing, or to help you the best for a better treatment outcome, is get early diagnosed and get treated appropriately.
Thank you, Dr. Prerna. So, as we just heard from Dr. Prerna, TB, while prevalent, is curable. And the best thing we can do for ourselves and our loved ones is educate ourselves about it and make sure we focus on our general health and well being and keep talking about this so that more and more people are aware and people get tested in time and treated in time. And we remember that there's life after TB. Thank you so much.